Hello and welcome to Ask Dr. Mingle, a new Q&A series from Mingle Health. I'm Kyle Breckel. I'm a digital marketing specialist here at Mingle Health, and I'll be hosting this episode along with Dr. Dan Mingle, founder and executive chairman here at Mingle Health. Good morning, Dr. Mingle.
Good morning, Kyle.
Before we jump into today's questions, I wanted to take a moment to talk about the inspiration for this project. At Mingle Health, we get quite a few questions about navigating value-based care. These questions are often about the specifics of the MIPS program, or primary care first, or ACO quality reporting, or really any other alternative payment model. And in our experience, these programs are a lot easier to navigate when you have an expert on your side. And that's actually what you get with your Mingle Consultant when you work with us, is an expert that you can rely on to ask questions and kind of help guide you through the value-based care landscape. And that was kind of the inspiration for this series, is that we wanted to give anyone the ability to reach out to us and ask questions and gain access to Dr. Mingle's experience and expertise. And we have a few questions ready today, but before we jump into those, I want to invite listeners to send us their questions for Dr. Mingle. You can leave your questions in the comment section below this video on YouTube, or you can leave us a comment on LinkedIn, or you can send us an email directly at hello@minglehealth.com. When you send us an email, make sure you put Ask Dr. Mingle in the subject line. I'll be checking for your questions there, and Dr. Mingle will pick a few of his favorites to answer in each episode. And with that out of the way, let's get into today's questions. Our first question for Dr. Mingle today is from Kenneth, and Kenneth asks, how do we help our providers stay motivated about their MIPS performance?
Well, thanks, Ken, for such a great question. Couple of pointers to keep your providers motivated. One, we all tend to be motivated by measurements. So when we're measuring, you may have heard the old saying, people improve what's measured. And of course, measuring itself doesn't keep it at the front of your mind. It's reviewing those measurements, keeping them visible. So I'd say that would be my number one recommendation. Keep the numbers you're trying to deliver visible to your providers. Update it at least quarterly, if not monthly. I don't see a lot of advantage to doing it more often than monthly, although you could get into a rhythm of that's more frequent. And as a group, as a practice, review these regularly. Ask those as you review them. Ask those questions. Well, how do our high performing teams get to that high performance level? What challenges do our lower performance teams face to become a higher performing team? And of course, if you're a small practice and you're one team, maybe even break it down by patients. How did you get to success in the patients that are in your performance met category? What are the challenges to get those who didn't get to success? What are the challenges of getting them there? But don't just think about the care. Our measurement system is not just looking at the care. There's lots of failure points. And you should be looking for those failure points. Who's asking the question? How do you find that a patient needs something? How do you recognize that? Who recognizes it? Who records it? How and where is it documented in your patient record? If you are recording it, if it's been done, you're recording it, is it being captured by your measurement system? Are the queries that are being done really showing those patients to be performance met when they should, and appropriately putting them in performance not met? Audit specific patients. And I would, if you're using our system, you'll be able to get down to a list of patients to go into each measure and whether they're performance met or performance not met, or exceptions for some reason, and pull out a handful of those every time you're reviewing it to look and see, are they appropriately in those categories? And if they aren't, why not? And there's many failures of the documentation and query system. And some of my best clients' practices are every year, over many years, they're steadily improving their systems, finding errors in the templates that create their notes, and errors in the database that they lose data periodically or at least from the measurement system. And finally, build it into your incentive payment formulas. And I would actually put this as the lowest priority. I don't think we have to build it into the incentive payment formula to get people to take it seriously. The other things I've mentioned, I think, are more important to actually get to improvement. But I think a lot of people find that present in the incentive payment formula to make it a lot more interesting for providers.
Great question, Kenneth. Thanks for sending that in to us. And we definitely know how frustrating MIPS can be. So hopefully there's some actionable insight there that you can use to help your providers stay motivated about their MIPS performance. Okay, on to our second question today. Sarah asks, what are some proactive strategies and methods to impact our scores throughout the year?
Great question, Sarah. The first thing you should do is look back at the answer I gave to Kenneth, who asks, how do we help our providers to stay motivated about MIPS performance? I think everything I said in the context of that question answer is entirely appropriate to this question as well. First, I'd say measure early and measure often. Robbing from fundraising from most public broadcasting systems. You want to not just watch your performance through the year, but look at it as a group. So it's in front of mind. Engage your practice as a team. It's not just on the doctor's shoulders or any of your provider's shoulders. It's a whole team process, and make sure everyone gets a chance to participate, to share their experiences, to share their ideas for improvement. If you're a small practice and have only one team, great, but still you may want to look at specific patients then more often and understand how we succeeded with this patient, why we didn't succeed with this patient, and start thinking about how you can improve that performance overall. Remembering that 100% performance is probably never appropriate. That there are some patients who simply don't want, so will not participate in some care things. As you look at your performance, as you look at specifics, and I think auditing is very important. From our analysis of your performance, you can drill through from the whole practice to the specific practice site or team to the particular patient. And you can, as you look at the patient, you can see how they succeeded, how they failed, certainly if they succeeded or failed. And it's important to take at least a sampling from that list and compare it to the chart to be sure that what we're revealing in your performance measurements is really how your patients perform. And uncovering that and improving that flow of data, that documentation. The care's got to be done. It's got to be documented, and the documentation has to show up in the measurement system. And so being open to the failures in multiple spots and how you correct that failure is important. And as you improve your care, and that improvement of your care should be at a regular basis, not just a once a year special event when you're reporting to Medicare or whoever else you have to report to, but a regular event that you're watching those through the year. And as you improve your system, make it an extendable, scalable system that works for more measures than just the one that's right on in front of you. If we jury rig, if we specially engineer a process to handle one measure, and you can't put a second in that same list, use the same techniques, then you've got a system that'll break down as you put multiple measures against it. Already in MIPS, you need 6 measures for a typical annual measure set. If you're in an ACO, you're going to need 3 measures in your annual measure set for the APP, the APM performance pathway that's coming. And if you're really trying to dig in deep and provide great care, there's more like 30,000 or more measures that you need. And we can build a system using an EHR that can deliver on 30,000 or more measures, but it certainly can't be. You can't even do 6 if each is a special one-time case. So that as you're building that system of care that delivers well on measures, you need to think about how to record characteristics of my patient. There's certain characteristics that put them in a denominator for any measure. Their demographics, their age, sex, their diagnosis list, their medication list, their allergy list. Depending on the measure, we'll take various things from those categories to say this is the denominator for that measure. So are you recording those things on a regular basis in a way that's recoverable in your measurement system? And then, of course, there's there's performance. When there's something that's been ordered or done, is that recorded in a way that's recoverable in your system? That's a numerator data is typically something we've done. It may be an immunization, it might be a medication, it might be a test, it might be any number of things. And then the final thing is exclusions. There's reasons why we don't, why we forgive a patient from some measures, because they opt out or there's something else going on. And is there a standard way that we're recording exclusions to measures that's easily recoverable? And as we build our system that performs well always for those things, we get that system that will expand any number of measures and expand for any few measures for multiple insurers or multiple stakeholders who make different demands of you. And finally, I'd say work on extra measures. MIPS again calls for 6 measures, and that's probably the best target. If you can, work on 12. The 6 you're intending to submit, and 6 others that you're preparing for submission. And it doesn't hurt it never hurts to submit extra measures. So you could submit all 12 each year and not be hurt by the low performing measures, because Medicare is going to select your best 6 performers to submit. And if you're working on those extra measures, then as measures inevitably drop out of the list, sometimes they top out and Medicare puts them in a queue to eliminate them from the list. Or other things might render a measure for that year irrelevant. So it's nice to have those others in abeyance, so you can always fall back on an extra measure. We also tend as a group to choose measures where where the documentation is relatively easy and straightforward, and we avoid those that are harder. So this gives you, those extra measures gives you a chance to work on some harder measures, and you're actually more likely to score higher. If you're doing a good job, you can get a higher score on those, because they're not going to be topped out. They're not going to have the points limited to 7 because they're a topped out measure. And you actually can also, by submitting those extra measures, get more contribution to a spread of benchmarks year by year.
Great. Thank you for the question, Sarah. And I love that advice. Measure early, measure often. Our last question today is from Sanjiva. Sanjiva asks, if our practice joins an ACO, do we still need to report MIPS?
Great question, Sanjeeva, and apologize if I'm a little wishy-washy on this. I'll say yes and no. Yes, in the sense that well, many practices these days are mixed. That some of you might be ACO and some of you might be MIPS, and of course, those who are MIPS are going to have a different reporting requirement than those who are in the ACO. So you may need to do both regardless. The second reason I'll be saying yes is you may be aware that Medicare is in a time of transitioning from the web interface method of reporting for ACOs to the APM methodology, APP, which is the APM performance pathway, which is really aligned with MIPS. It's the APP includes 3 classic MIPS measures. So in a sense, you're going to be reporting MIPS, so a smaller measure set, but it still is within the MIPS measures. And although you might say it's the ACO's charge to do the reporting, it's their responsibility, you're going to have to participate. Medicare wants an accurate report with deduplicated patients, which means the data all has to be combined, and you're going to be responsible for your data with a patient-specific denominator and numerator. And then someone like us, or at the ACO level, who brings all that data together and blends it into one report with a single denominator, single numerator, and a reliable number. And in some ways, because it has to blend with everyone else, is a little harder, a little more of a challenge than just MIPS reporting, but still very much the MIPS measure specifications and process.
Yeah, thanks for that question, Sanjeeva. It's a good one, and it's one that we see relatively often here at Mingle. So hopefully that gives you a good idea of how it would affect you if you were to join an ACO. Okay, Sarah, Sanjeeva, and Kenneth, thank you again for the questions. And I want to once again encourage everyone listening to send us your questions, please. You can leave a question in a YouTube comment or on LinkedIn, and you can email your questions directly to us at hello@minglehealth.com. When you do, make sure you put Ask Dr. Mingle in the subject line, and I will collect your questions there and get them to Dr. Mingle, and you could have one answered on a future episode of Ask Dr. Mingle. Thank you, Dr. Mingle, for sharing some of your expertise and knowledge with us today.
Thank you, Kyle. It was lots of fun. Please, everyone, send your questions in. I love getting them, love answering them. Also, send your comments. If you have a different perspective on this, a different understanding, I'd love to hear from you. I'd love to learn more myself if you have something to share that I didn't include. So please, I'd love to see this to be a discussion. Love for us all to learn together. Thanks, and see you soon.